Mr. Philip Davis, the Permanent Secretary for Health and Medical Services, Dr. Corinne Kopuano from the World Health Organization, and also Dong Lien Lee from the ILO. And ladies and gentlemen, glad to be back here this afternoon. It's Friday afternoon, so you're all looking forward to the weekend. But we have one more important thing to do this afternoon. So I'm delighted to be back here to jointly launch with the Ministry of Health and Medical Services the Occupational Health and Safety and Occupational Health Services Profile for Fiji. This follows the opening of the World Day for Safety and Health at Work this morning with the theme for this year's celebration, Optimize the Collection and Use of Data, of OHS data. This afternoon's event is also very significant in working towards fulfilling this year's World OHS Day theme, the launching of Fiji's first ever Occupational Health and Safety and Occupational Health Services Profile is historic in that Fiji's name can now be recognized on the international stage in relation to where we are in terms of our occupational health and safety status. It is fair to say that optimizing the collection and use of OHS data is an area that will need the collaboration of all stakeholders. And the launching of our profile this afternoon is just the beginning for our stakeholders to start working closely with each other on a more regular basis as we update it and as we keep making plans on how we're going to improve that profile. I'd like to acknowledge the work that was done by our World Health Organization consultant, Dr. Ranatanen, and Dr. Kim, who is here this afternoon, together with his team from the World Health Organization Fiji office, the ILO Fiji office, the Ministry of Health and Medical Services, the Fiji National University, USP, and also the staff from my ministry, the Ministry of Employment. A special acknowledgement to our tripartite partners and members of the National NOSHAB, National OHS Advisory Board, for their continued support, advice, and tireless efforts in striving towards the continuous improvement of occupational health and safety in Fiji. I was approached, I think, a few weeks ago by the World OHS Day Organizing Committee to seek my views on the launch date for this OHS profile. This was because there's quite a lot of volume of work to be done. It's not an easy thing to be able to develop this profile. My response to the committee was to ensure that the profile is ready for launching during the World OHS Day today. So for all of you in that committee and all of you, I give these instructions, but I know there's a lot of work to be done. So all of you, thank you, congratulations for being able to do this. I know that our first profile will not be 100% perfect. No profile forever is, because it's a dynamic thing, but it's a starting point or a reflection of the country's actual situation in relation to the working conditions, the health status of our working population, the policies in place, the institution and other resources available to look after OHS. Our OHS profile should also be able to identify what our strengths are, the challenges we face, the opportunities for improvement, and the likely risks that could be encountered at all the different levels. Having this profile will enable all stakeholders to understand the important role that each one plays in contributing towards the health and safety of our workers. As ministry responsible for employment and productivity, it's very important for my ministry to be able to know and understand the status of the working population, as healthy workers will contribute towards increasing productivity when productive hours are not lost through sick leave or absenteeism or even presenteeism, which is a term we've been talking about in Parliament this week. Healthy worker contributes to a productive workforce, which in turn contributes towards a wealthy and sustainable nation. In strengthening the OHS aspect, as part of our labor reforms, my ministry has established the Occupational Medicine Unit as part of the workers' compensation when Dr. Tuineau, who's sitting in front of us, was seconded from the military in 2010. This was initially to assist in the clearing of backlog cases from the years 2001 to 2009. With new opportunities now in the labor markets being secured for our local workers through the New Zealand Recognised Seasonal Employer Scheme and the Australian Seasonal Work Programme, meeting the demands for occupational health services has now become a challenge for my ministry. With the engagement of Dr. Tuineau in conducting medical assessments for potential workers under the Foreign Employment Services, conducting final assessments for injured workers are now being strategized to cater for other demands. This is an area which I believe the profile can bring closer collaboration between my ministry and our partners from the Ministry of Health and Medical Services to explore more on opportunities available. The demands for other occupational health services in Fiji are huge, and some of these include the rehabilitation and return to work programs for injured workers, pre-placement examinations, fitness to drive, fitness to fly, ergonomic assessments, hearing impairment assessments, medical opinions. However, with our limited resources available, I believe that the launch of our profile will also provide more opportunities to build capacity on human resources and seek assistance in terms of technical and monetary assistance from our international partners who are also present this afternoon. I am being informed of the upcoming World Health Organization sponsored OHS and hygiene training, which is scheduled for next week from the 2nd to 5th May at the Southern Cross Hotel. Our launching of the profile today is just the beginning of another chapter in Fiji's history. On this note, I wish to state my ministry's commitment. We are committed to continue working together with all stakeholders to fulfill our profile recommendations. In developing and implementing of sound policies and action plans, I seek the continued support of our tripartite partners in working together to continue improving the health and safety of all of our workers. Thank you. Nakawaleo and Danyabad.